Inside what is typically the province's busiest emergency department, the silence is striking.
It's a heightened anxiety, definitely, but it's changed our intake of people because we've told the people to stay away.
For those who simply can't, the first point of contact is a registered nurse, like Lisa Wright, on the front lines outside Surrey Memorial Hospital.
For the most part, this is what I signed up for. This is my job. This is what I do. It's fine.
You'll be asked if you have any symptoms.
We were invited inside by Fraser Health, its leader no stranger to combating communicable diseases and past pandemics.
Have you ever seen or witnessed anything or expected anything of this magnitude to hit so close to home in your career?
No, not at all. Well, I think people talk about extraordinary times and unprecedented challenges, and we've never had this level of measures that have been put in place. When you see some of the health systems that are supposedly comparable to our health systems and they're not coping very well, it does make you really take a serious attention to how we're preparing for this pandemic.
Health systems like Italy's, where the COVID-19 wave crashed with little warning and devastating consequences. The disease overwhelming and overburdening resources in even well-developed countries.
As sort of information came out of Italy, it radically changed our approach.
The approach to treating patients is changing just as rapidly as the data.
It starts in the lungs without a doubt, but the immune system, as it gets ramped up to fight the virus, can also damage the body. The muscle aches and pains that a lot of people complain of early in the disease are probably, at least in some way, the immune system, the inflammation affecting the muscles.
And deciding which patients need one of these can present its own challenges.
The reality is, when we talk about critical care, dying is not the worst possible thing that can happen to people. The ventilator is not harmless. So we have a big plastic tube that goes through the vocal cord so people can't talk, and they choke with every breath. Being young and getting sick with this is not a guarantee of doing well.
Fiona McLeod and her colleagues are all too familiar with one of the compounded cruelties of the novel coronavirus.
A lot of our patients are unfortunately on ventilators and can't speak to us.
But they can listen.
Recently, we had a nurse who was in the room with the patient, holding the patient's hand, had the family on speaker, and assured the family that the patient could hear them, that they knew that they were there.
Are you worried about contracting COVID yourself?
Well, yeah, I think everybody is.
Sometimes the hand a patient holds isn't always familiar in a pandemic. Sarah McDonald, Global News.